Hello everyone and welcome to this week's edition of the OncoAlert Weekly Roundup. I'm your host, Gil Morgan, and this week the overarching theme is clear. Immunotherapy and precision approaches are making headway across multiple tumor types. Whether it's enhancing pathological responses in early stage disease or offering new options for resistant cancers, personalization is key. Reminding you that these are just some of our picks, and for a deeper look, we invite you to subscribe to our newsletter. You can find us at www.OncoAlert360.com or through the link and QR in this post. That's www.OncoAlert360.com. Now let's dive into the latest findings. We start with breast cancer. A recent review in Current Opinion in Oncology highlights the role of immunotherapy in the neoadjuvant setting for hormone receptor positive, HER2 negative early breast cancer. Adding immune checkpoint inhibitors to standard chemotherapy has been shown to increase pathological complete response rates. Researchers are also exploring novel strategies like combining immunotherapy with radiation. While these approaches are promising, careful patient selection and monitoring for immune-related side effects are essential, and longer follow-up is needed to determine the impact on long-term survival. So what's the take-home? Adding immunotherapy to neoadjuvant treatment in hormone receptor positive, HER2 negative early breast cancer improves pathological response rates, but ongoing research is needed to optimize patient selection, combination strategies, and long-term outcomes. Also in breast cancer, the FDA approved inavolisib with palbociclib and fulvestrant for adults with endocrine-resistant PIK3CA mutated hormone receptor positive, HER2 negative advanced or metastatic disease, based on the INAVO120 trial, showing significantly improved progression-free survival and response rates. Next, lung cancer. A phase 2 study in EGFR mutation positive non-squamous non-small cell carcinoma resistant to first-line osimertinib explored the combination of afatinib, carboplatin, and pemetrexed. This ACP regimen showed a 6-month progression-free survival of 57.1%, a median PFS of 8.2 months, and an overall response rate of 51.4%, with manageable side effects. Take-home, ACP offers a promising option for patients with osimertinib-resistant EGFR-mutated non-small cell lung cancer. In GU Oncology, the GETUC-14 trial showed that adding short-term androgen deprivation therapy to high-dose radiotherapy in intermediate and high-risk or localized prostate cancer improves 5-year disease-free survival and reduces biochemical and metastatic failure without increasing significant toxicity. So what's the take-home? Short-term ADT plus high-dose radiotherapy remains an effective and well-tolerated approach for high-risk localized prostate cancer. And in GI cancer, cohort analyses from multiple countries indicate that individuals born after 1960 face substantially higher risk, particularly before age 40, suggesting early life exposures play a significant role. The take-home being that clinicians need to be aware of the rising risk in younger populations and considering early screening and preventive strategies. And in skin cancer, melanoma management continues to advance. Surgical excision remains the standard of early disease. Adjuvant anti-PD-1 therapy improves outcomes in high-risk stages, and dual checkpoint blockade and targeted therapy benefits metastatic or BRAF mutated disease. The take-home being that personalized approaches combining surgery, immunotherapy, and targeted therapy are improving long-term survival in melanoma. And in other highlights, preoperative fractionated stereotactic radiotherapy for resected brain metastasis reduces nodular meningeal disease and overall adverse outcomes compared to post-operative treatment. And in gynecological cancers, a single-port robotic staging using the Da Vinci SP system appears safe and feasible in early-stage ovarian cancer, offering a minimally invasive surgical option. As we close this week's roundup, the key message is clear. Oncology is moving towards precision and personalization. From immunotherapy in early-stage breast cancer to targeted therapies in resistant lung cancer, the focus is on improving outcomes while tailoring treatments to individual patient needs. That's all for this week. I'm Gil Morgan, and thank you for listening to the OncoAlert Weekly Roundup. Stay informed, stay inspired, and as always, stay OncoAlert.